Hello, everybody. Welcome, and I hope you will learn about middle range theories in nursing. Today is week 7 for Module 7. I am your podcaster, Maria Carmela Storco. Today is October 20th, 2016. I will be discussing the following: definition of middle range theory in nursing, purpose of middle range theory, functions of middle range theory in nursing knowledge development, characteristic, concepts and relationship for middle range theory, categorizing, development, approaches for middle range theory generation, and evaluation of middle range theory. First, what is middle range theory? It is defined by Smith and Lear as a set of related ideas that are focused on a limited dimension of the reality of nursing. It is composed of concepts and suggested relationships among concepts that can be adopted in a model. A middle range theory lies between the grand nursing models and our more circumscribed, concrete ideas. It is substantively specific and encompasses a limited aspect of the real world. According to Posset and De Santomadea, a middle range theory may be description of a particular phenomena, an explanation of the relationship between phenomena, or predictions of the effects of one phenomenon or another. Thus, it provides basis for generating testable hypotheses related to a particular nursing phenomena and to particular client population. The discipline of nursing recognizes middle range theory as one of the contemporary trends in knowledge development, and there is a broad acceptance of the need to develop middle range theories to support nursing practice. Each discipline has a unique focus for knowledge development that directs inquiry and distinguishes it from other fields of study. Nursing knowledge is the inclusive total of the philosophies, theories, research, and practice wisdom of the discipline. Therefore, nursing is a professional discipline. According to Morris, Suppi, this call to develop middle range theory is consistent with the third stage of legitimizing the discipline of nursing. There are 3 stages of introduction to middle range theory. First stage focuses on the differentiation of the perspective of the emerging discipline, which is characterized by separation from antecedent disciplines, example is medicine, and establishment of university-based education, which in nursing occurred in 1950s and 1960s. Second stage, marked by the quest to secure institutional legitimacy and academic autonomy. It is in this stage when pursuit of nursing unique perspective on and clarification of the phenomena of interest to the discipline were stressed. Third stage, distinguished by increased attention to substantive knowledge development, includes development and testing of middle range theories. This stage is expanding and evolving further to include evidence-based practice and situation-specific theories. Those are your 3 stages of introduction to middle range theory. To move on, purpose of middle range theory. It is to describe, explain, and predict phenomena. Unlike grand theory, they must be explicit and testable, thus easier to apply in practice situation and to use as a framework for research studies. And then, potential to guide nursing intervention and change condition of a situation to enhance nursing care. It defined or refined the substantive component of nursing science and practice. And Lenz, by the way, in 1996 noted that practicing nurses are actually using middle range theories but are not consciously aware that they are doing so. And then, middle range theory addresses relatively concrete and specific phenomena by stating what the phenomena are, why they occur, and how they occur. And last, it provides structure for the interpretation of behavior, situations, and events. Middle range theories support the understanding of the connection between diagnosis and outcomes and between intervention and outcomes. That is the purpose of your middle range theory. And now, factors that enhance the focus on middle range theories. It is more useful in research than grand theories. because of their low level of abstraction and ease of operationalization. Support prediction better than grand theories due to circumscribed range and specificity of the concepts. And it is likely to be adopted in practice because their relative simplicity eases the process of developing intervention for identified health problems. Those are your factors. And now we'll go to functions of middle range theory in nursing knowledge development. Functions of middle range theory in nursing development use as theoretical frameworks for research studies, open to use in practice, and should be tested by research. Can be the scientific end product that expresses nursing knowledge. Those are your functions, or their functions rather. And now, characteristic of middle range theory. It should be relatively simple, straightforward, and general. Consider a limited number of variable concepts. They have a particular substantive focus and consider a limited aspect of reality. And it should focus on client problems and outcomes, effects of intervention on client. It should be specific to nursing. Specify an area of practice, age range of the client, intervention and outcomes. Thus, middle range theories contain concepts and statements from which hypotheses may be logically derived and empirically tested. And now, concepts and relationships for middle range theory. Consists of two or more concepts and a specified relationship between concepts. Address phenomena with the meta-paradigm concepts at one end, and at the other end, specific concrete actions or events such as medication administration, preoperative teaching, electrolyte management, fall prevention. The concept should be discrete, observable, and sufficiently abstract to be applied across multiple settings and used with clients with differing problems. Those are your concepts. Categorizing middle range theory. Lear and Smith analyzed 22 middle range theories published during the previous decades. These theories were categorized as high middle, middle and low, or low and middle, or rather high middle, middle, and low middle. It was based on their level of abstraction or degree of specificity. High middle. Concepts such as caring, growth and development, self-transcendence, resilience, and psychological adaptation. Example, tidal system theory. It is for psychiatric and mental health nursing. Purpose of which is describe psychiatric nursing practice focus on three care processes, emphasizes the fluid nature of human experience characterized by change and unpredictability. Major concepts of which is personhood, discrete holistic assessment, focus assessment, empowerment, narrative as the medium itself. That is your high middle range theory. And then your middle range theory, concepts such as uncertainty and illness, unpleasant symptoms, chronic sorrow, peaceful end of life, cultural brokering, and nurse express empathy. Example is Theory of Caring by Swanson. Purpose proposes a definition of caring and the 5 essential categories or process that characterize caring. Major concepts: knowing, being with, doing for, and maintaining belief. That is your middle range theory. And for our low middle range theory, those that are closer to practice or situation-specific theories: hazardous secrets, women's anger, nurse midwifery care, acute pain management, helplessness, and intervention for post-surgical pain. Example of which is acute pain management by Good and More. purpose, proposes prescription for nursing activities to reduce pain after surgery or trauma to ensure that clients have less intense pain with minimal side effects of medication. Major concepts: potent pain medication, pharmacologic adjuvant, non-pharmacologic adjuvant, assessment of pain and side effects, goal setting, and balance between analgesia and side effects. Moving on, development of middle range theory. Middle range theories emerge from combining research and practice and building on the work of others. Sources are literature reviews, qualitative research, field studies, conceptual models, taxonomies of nursing diagnosis and intervention, clinical practice guidelines, theories from other disciplines, and statistical analysis of empirical data. We're still on the development of middle range theory. We have the approaches to middle range theory generation. Where do we get it? So, it is derived from research or practice. It is the most common source. Example is from qualitative research, theory of normalizing risky sexual behaviors. Theories report combining qualitative research with literature review, concept analysis, concept synthesis, and other techniques in the process of developing middle range theory. And then, derived from a grand theory. Develop into theoretical proposition focusing on nurse-expressed empathy is of Olson and Hanchett's middle range theory, which was derived from relational statements from Orlando's model. And then, combining existing nursing and non-nursing theories. Sosa and Soshinwisky used Orem's self-care theory and Bandura's self-efficacy theory to develop a theory of diabetes self-care management. And then, derived from a non-nursing discipline, a significant number of middle range theories are developed from one or more non-nursing theories. Examples are behavioral sciences, sociology, physiology, and anthropology appear to be the most common source for theory development. Example of which is Kolkaba's theory of comfort was derived from medicine, psychiatry, ergonomics, and psychology. And then, derived from practice guideline. Ruland and Moore developed the theory of peaceful and end of life from standards of care from terminally ill patients. Those are your approaches to middle range theory generation. Middle range theory development, according to Lear and Smith, should be clearly articulate the theory name, succinctly describe approaches used for generating the theory, clarify the conceptual linkages of the theory in a diagram model, elucidate the research practice links of the theory, explain the association between the theory and the discipline of nursing. That is your middle range theory. We now go to the evaluation of nursing theory. Evaluation of theory is essential to the life of the theory, leading to its extension, revision, and refinement. According to Wall, middle range theory should provide specific empirical reference for defined concepts, ability to operationalize and measure aspects of the theory is extremely important in middle range theory, and operational definition should be evaluated. Analysis of middle range theories to assess congruence with the grand theories. And then Smith has a format for middle range theory evaluation. First is substantive foundations. Theory was within focus of nursing, provides substantive description, explanation, or interpretation of a phenomenon that would be considered middle range, and theory is rooted in practice or research experience. And then structural integrity. Concepts are clearly defined and at the middle range of abstraction. Number of concepts is appropriate. Concept relationships are logically represented with the model. And lastly, functional adequacy. Theory can be applied in practice or with various client groups. Empirical indicators have been identified for theoretical concepts. There are published examples of use of the theory in practice research. To sum it up, middle range theory is defined as a set of related ideas that are focused on the limited dimensions of the reality of nursing. It is composed of concepts and suggested relationships among concepts that can be adopted in a model. According to Morris and Suppi, this call to develop middle range theory is consistent with the third stage of legitimizing the discipline of nursing. We discuss purpose of middle range theory, purpose of which is to describe, explain, and predict phenomena. And then factors that enhance the focus on middle range theories. They said it's better than grand theory. And then functions of middle range theory in nursing knowledge development. It is used as theoretical frameworks for research studies, open to use in practice, and should be tested by research. Can be the scientific end product that express nursing knowledge. And then characteristic of middle range theory. It is relatively simple, straightforward, and general. Concept and relationship for middle range theory. It consists of two or more concepts and a specified relationship between concepts. And then categorizing middle range theory, there is high middle, middle, and low middle. It was based on their level of abstraction or degree of specificity. Development of middle range theory. Middle range theories emerge from combining research and practice and building on the work of others. And then lastly, evaluation of middle range theory. Evaluation of theory is essential to the life of theory, leading to its extension, revision, and refinement. And that's it. This is the end of my podcast. Questions pertaining to middle range theories will be posted separately. I hope you have learned lots about middle range theories. Good day to all, and thank you for listening.